Alright, so what is endometriosis? So endometriosis, basically defined, is where endometrial cells, or it's a condition where these endometrial cells grow in a place where they're not really supposed to. It's quite common in the general reproductive age women. The incidence is about 10%, but the incidence or the amount of women that have it that are struggling with fertility is a lot more. Right? So in women that are struggling to conceive, we find endometriosis in 50% of them. Right? So it is a huge contributing factor to endometriosis. So what are the symptoms that might make you think that you've got endometriosis? So one of the most common symptom is painful menstruation. All right, so a lot of women think menstruation should be painful and accept a huge degree of discomfort and effect on their quality of life and think that that's what it's supposed to be. But it's not. And if you regularly have to take anti-inflammatories or miss work or don't do your normal daily activities because of menstrual pain, then that is abnormal and you should go and consult your doctor about that. So painful intercourse, one of the big symptoms of endometriosis, and we specifically there refer to what we call deep dyspareunia or deep pain with intercourse, or intercourse with deep penetration, and that's because of the pelvic structures and the pelvic anatomy that's distorted by the endometriosis. So if you are experiencing discomfort, then that is also not normal. Infertility, one of the other leading symptoms of endometriosis. Like I said, 50% of women presenting at an infertility clinic will have a degree of endometriosis. Endometriosis, depending on its severity and whether it infiltrates other organs like the bowel or the bladder, might cause pain or bleeding even when passing stool, or when discomfort when urinating. And then there are some other more non-specific symptoms like indigestion, some nausea, and then excessive bleeding, a bit more associated with what we call adenomyosis, and that's a type of endometriosis that grows in the wall of the womb or of the uterus. But this is basically then how we make the diagnosis of endometriosis based on a few of these major symptoms that I've just showed. You don't have to have a laparoscopy to diagnose the endometriosis. Right, so endometriosis is a clinical diagnosis that can be made by your gynecologist or your fertility specialist, and then the treatment decided on there. So what investigations do we often use when we have a patient with endometriosis? A good pelvic ultrasound will tell you if the endometriosis is involving the ovaries, like in the form of an endometriotic cyst or an endometrioma. Often the ultrasound also guides us in fertility counseling because we can evaluate the ovarian reserve and the effect of the endometriosis on the ovarian reserve. You sometimes see that the structures are not as mobile on ultrasound, and that the ultrasound examination is painful for the patient. And those are all subtle signs of endometriosis. And then a laparoscopy in our hands are to treat the endometriosis, not to diagnose the endometriosis. All right, so you don't need a laparoscopy to diagnose the endometriosis. If you think you've got endometriosis and you're struggling to conceive, you should go see a fertility specialist, so that when they do go and do the laparoscopy, that is part of your fertility planning, that they can treat the endometriosis there. I think that's an important message, is not to go and have unnecessary surgery at the general gynecologist just to diagnose your endometriosis and then be referred to a fertility specialist that will then, as part of your treatment for your fertility problem, will go and operate you, and you're having unnecessary surgeries. Right, so I think that's an important message. How does it affect fertility? So on the left you will see the normal reproductive system that has a healthy womb, fallopian tubes and the ovary and the fimbria of the ovary, and the whole system there all runs smooth around each other and functions very well. Now the moment you've got endometriosis, there's a certain degree of inflammation in this whole system. And the inflammation, with recurrent inflammation, causes fibrosis and stickiness, and everything starts to stick together. Okay, and this is one of the first problems with endometriosis, all right, is that you've got anatomical distortion. Okay, so the pickup mechanism and the dynamic interaction between the ovary and the fallopian tube doesn't work anymore, and the egg can't be picked up properly. Okay, so the anatomical distortion plus this inflammation affects this very delicate microcosm in the fallopian tube, and that is what is causing the infertility. Endometriosis also has a direct effect on egg quality, all right, because of oxidative stress, all right. So the one is anatomical distortion and the function of the ovary and the fallopian tube, and the second one is inflammation, oxidative stress, and the impaired or the whole inflammatory milieu that is created by endometriosis. So there's two big ways to manage endometriosis: medical management and surgical management. So medical management then can further be divided into symptomatic treatment, which is just drugs that will treat the symptoms that you are experiencing, but it's not actually doing anything to the disease itself. And there we refer to things like anti-inflammatories or non-steroidal anti-inflammatory drugs that you then take during your cycle or just before your period starts, when you know that you're going to experience a lot of pain. If you also suffer from heavy bleeding, your doctor or your gynecologist might put you on antifibrinolytic treatment like cyclocapron or Tranic, which will then decrease the amount of bleeding you have if that is one of your symptoms. The suppressive treatment, that actually suppresses the growth of the endometriosis, all of those treatments are hormonal, and their aim is basically to oppose the estrogen. Estrogen is what fuels the fire of endometriosis, okay? And cyclically, in every cycle, if you ovulate, if you've got ovulatory cycles, your ovary or the granulosa cells in your ovary produces high